This is a quick review of patients with Huntington's disease. Huntington's disease is an inherited condition caused by a single abnormal gene. This illness is an autosomal dominant disorder because only one copy of the defective gene inherited from either parent is necessary to produce the disease. If one parent has the single faulty gene, the chance that the offspring will have the defect is 50%. Because signs and symptoms typically first appear in middle age, some parents may not know that they carry the gene until they've already had children and possibly passed on the trait. Huntington's disease affects a person both physically and mentally. One of the first physical symptoms is muscular twitching called chorea. Chorea is derived from the Greek word for dance and is best described as slow, dance-like movements that may affect the limb, torso, and face. And this is why the movement is called Huntington's dance. The early signs and symptoms of Huntington's disease can vary significantly from person to person. It usually develops slowly, and the severity of the signs and symptoms are related to the degree of nerve cell loss. Death occurs in about 10 to 30 years after signs and symptoms first appear. The disease progression may occur faster in younger people. Early signs and symptoms of Huntington's disease include personality changes like irritability, anger, depression, or loss of interest. Also, decreased cognitive abilities like making decisions, learning new information, answering questions, and remembering important information. They may have mild balance problems, clumsiness, involuntary facial movements such as grimacing, and it's usually the family and friends that first notice these changes before the patient becomes aware of them. Late signs of Huntington's disease can include sudden, jerky, involuntary movements, which is the chorea, throughout the body. Severe problems with balance and coordination, jerkiness, rapid eye movements, hesitant, halting, or slurred speech, and swallowing problems. Some people who develop Huntington's disease may have signs and symptoms that mimic Parkinson's, the muscle rigidity, tremors, and slow movement. Seizures may also occur in those with early onset of Huntington's disease, and dementia may occur later in the disease. After onset of the disease, signs and symptoms continue until death. Though signs and symptoms vary from person to person, vital functions such as swallowing, eating, speaking, and walking usually degenerate over time. Depression is common in Huntington's disease, and some people are at risk for suicide. However, death generally occurs as a result of a complication of the disease, such as a fall or an infection like pneumonia. Proper nutrition is very important because the person with Huntington's may have trouble getting enough calories. They may need to eat several times a day. For patients with Huntington's who have trouble eating and swallowing, the caregiver should cut the food into smaller bites or puree it to make it easier to swallow. To prevent dehydration, the patient will need to get enough to drink every day. Caregivers of people who have Huntington's can take steps to help the patient with daily activities. It can be helpful to the patient to keep their environment as normal as possible. Exercise can help the patient physically and mentally, so the person with Huntington's should try to do as many physical activities as possible. Speech. Dysarthria often is characterized by slow or slurred speech that can be difficult to understand. Speech and language therapy may be necessary to help regain normal speech. A speech-language pathologist can determine the severity of the speech difficulties, develop a treatment plan to improve speech, and then work to put the plan into action. If it is not possible to improve the speech to a level that allows for effective communication, then other communication methods would be needed, such as visual clues, gestures, an alphabet board, or electronic equipment, all used to help improve communication. PTOT. The patient should walk as much as possible, even if assistance is necessary. Daily exercise promotes physical and mental well-being, and falls are always a risk, so keep surroundings free of hard, sharp objects. Wearing special padding during walks helps protect against injury from falls. Small weights worn around the ankles and sturdy, well-fitting shoes that slip on and off easily can improve a patient's stability. There are experimental treatments. One area of research is a combination of certain cancer and age drugs, and the combination has halted the progress of Huntington and fruit flies. Also, the use of stem cells is another avenue for research. Transplanted in the brain, stem cells might help reduce some of the damage that has been done to the neurons in the brain. Caring for patients affected by Huntington's disease offers many challenges. It is a complex illness that prevents the person suffering from it with a difficult mixture of profound physical disability and mental health problems. The progressive nature of the illness means that a person needs to be constantly reevaluated and assessed. Unlike many illnesses, the treatment of symptoms is often a question of trial and error. However, good symptom control is possible, and the nurse's role is to evaluate the effectiveness of any treatment. A holistic approach is essential, and it's important to bear in mind the hereditary nature of the illness, as this does impact on the family and their perception of the situation. The nurse must always take responsibility for making communication with someone affected by Huntington's disease as easy as possible, and this can help reduce some of the frustration associated with poor communication. Even during the earlier stages of Huntington's, communication can be affected, and this may present as slowness in response or a rapid outpouring of words. Early referral to a speech therapist is essential, as is the regular assessment of the individual as the disease progresses. As the speech deteriorates, sadly, a lot of the clues that we would normally use to detect nonverbal communication are also interfered with due to the movements associated with the illness. Communicating in a calm environment allows plenty of time for a response, and asking simple questions that require one-word answers can help. It is essential to obtain as much information about the patient as possible from family members if a patient comes to you once their communication has deteriorated, and it will help facilitate easier communication with the individual. Behavioral difficulties. People with Huntington's disease are often misunderstood. They're often loud and difficult to understand. Speech coupled with the involuntary movements can present a frightening picture to someone who is not familiar with the illness. The person with Huntington's can become angry and frustrated by the demands placed upon them. It is difficult as a caregiver for them not to take this personally, but remind them that it is the illness, not the person, that is creating the difficulty. Nutrition. People with Huntington's disease usually require a higher calorie diet than usual. It is essential that they be offered small meals often with snacks available in between. As the disease progresses, the mechanics of feeding themselves becomes more difficult, and it is essential to offer assistance. Early referral to a dietitian and speech therapist and constant reevaluation is always essential as swallowing problems change with the progression of the illness. As the need for liquidized meals becomes necessary, it is essential to ensure that these are presented in as attractive way as possible. Knowledge of the individual's likes and dislikes are important. When feeding someone affected by Huntington, it is important to allow time and ensure that the environment is quiet and calm. People affected by the illness often do not like eating in front of others, so it is important to be able to facilitate somewhere they can eat supervised, but without feeling as if they are being watched. Mobility. It's important to remember that people with Huntington's disease will develop a distinctive gait that to an onlooker may appear unsafe, but left to their own devices, they can usually mobilize reasonably safely. Ensuring the environment around them is padded and has no sharp edges, as well as providing grab rails, may maintain mobility for some time. Eventually, with the progression of the illness, people will become wheelchair-bound. Washing and dressing. Maintaining personal hygiene for someone with Huntington's disease can become increasingly difficult as the illness progresses. The cognitive difficulties faced by someone with Huntington's, coupled with the difficulty in actually performing tasks due to the disruption in voluntary movements and the presence of involuntary movements, can often make the person with Huntington's unwilling to maintain their own hygiene needs. Sometimes they are willing to allow the staff to assist, and other times they may refuse. It's important to avoid confrontation, as this will not solve anything. The establishment of an agreed routine at a time when the patient is at their best will achieve a better result. It's important to create the right environment, which is warm, calm, and structured, as the person with Huntington's will be feeling very vulnerable and insecure. Elimination. Even during the earlier stages of illness, people may present as being incontinent, and this can be due to the reduction in mobility or difficulty in removing clothes in time due to involuntary movements. Ensuring a close proximity to the toilet and appropriate clothing can help reduce the risk of incontinence. The lack of drive and motivation associated with the cognitive aspect of the illness can sometimes mean that people can respond to gentle reminders to go to the toilet. If someone becomes incontinent, it's important not to assume that it is the next stage of the illness until there is an assessment and establishes that there is no underlying cause such as urinary tract infection or bowel infection. Once someone has become incontinent, the sensitive handling of changing the patient as necessary is essential. The medication that people with Huntington's are prescribed can often lead to a person developing constipation. This obviously needs to be monitored and addressed appropriately. The progressive nature of Huntington's disease and the communication and cognitive impairment that people face later on in the illness means that it is essential that some consideration early in the illness is given to what the person affected by the Huntington's disease wishes when it comes to some more difficult decisions. Clearly, this is a very sensitive area that should be approached with care, but if a patient's wishes are recorded when they're able to express them, it makes the decision making easier when the need to do so becomes necessary. Areas that need considering include care at home or as an inpatient, gastrostomy feeding, life-sustaining emergency procedures, use of antibiotics to treat infections, guardianships, living wills, power of attorney, and brain donation for research. Caring for patients with Huntington's disease presents with many challenges. The complexity and diversity of the illness and the way it affects individuals is reflected in the diversity of the symptoms. It is essential to look beyond the illness to the person involved and offer the best quality of care. Nursing care involves family support that is both physiologically and psychosocially challenging. Physiological challenge is relieving spasticity, improving coordination, train the patient to substitute unaffected muscles for impaired muscles, and strengthening exercises for muscles involved in postural control. Psychologically, this is difficult for the caregiver who are watching the deterioration of their loved one, knowing that this may be their fate as well. Exercising regularly is beneficial. It helps both physical and emotional health. Wearing well-fitting, sturdy shoes during exercise may help improve stability. Maintaining proper nutrition. These patients may burn as many as 5,000 calories a day, so they need to get adequate nutrition to maintain body weight and consider extra vitamins and supplements. Because Huntington's disease can impair coordination, they may need assistance when eating, giving themselves as much time as they need for meals. Cutting food into small pieces or eating pureed food may make swallowing easier and prevent choking. Dairy products may secrete excess mucus, which may increase the risk of choking. Occupational therapists and speech therapists may make other suggestions on how to improve swallowing. Using cups with lids and suction cups and tableware designed for people with disabilities may help prevent spills. And drinking plenty of fluids. Huntington's disease can make the patient vulnerable to dehydration. Drinking large amounts of liquids, especially during hot weather. And some find that the bendable straws make drinking easier.